generated, it is a part of my Aadhaar ID DigiLocker, and it can be accessed wherever I go, and the need to carry thousands of papers or hundreds of papers and trace them every time one visits a health professional, that is not required. So this is a very key ecosystem which is cutting across all other health platforms and is really going to transform the state of digitalization and technology intervention, not only in UP but in the country. Two other key platforms which UP has developed and is very well using are the UPK Swasthya Kendra portal and the Manav Sampada portal. The first one is a geotagged digital repository of all the public health facilities. All the 32,000 plus health facilities in UP are tracked on it. Their manpower, the availability of drugs, medicines, equipments, and of course, the analytical report generation is also a component of it. So everything is online so that any citizen can see where a public health facility is, what is the available strength, what is the available medicine in that. Similar to this is the Manav Sampada portal where this deals with the manpower. So all the paramedics, all the doctors, all the staff listening to this portal and their entire life journey from beginning from entry into the service to their exit, their service records, their leave records, everything is online. So these they may look like simple platforms, but talking in terms of a state which maybe 5 to 10 years down the line did not have any digital data, getting so much information on a digital platform and keeping it updated on a real-time basis has been a huge challenge, and UP has been able to do it successfully. Now, another foundational platform moving ahead is how do we deliver services in these facilities. So, way back, the supply of medicines in hospitals used to be a big challenge. Only 30 to 40% used to be available. Now, the entire system, right from procurement to their reaching the warehouses, to their delivery in the hospital, everything is tracked online through the DBMS portal. We have around a list of 300 essential drugs, and 95% of them are available at any time in all levels of hospitals. We are in the process of procuring 100 more essential drugs to reach out at different levels. So while these were the backbone foundational systems which are transforming UP's health landscape, talking about the community health ecosystem, eKavach is a platform which is a kind of a population register for all the citizens of UP. 85% of UP's population is linked to it. Before that, we did not have any line data. We did not have any list. Now, every record, every citizen is, or as I said, 85% is linked to it. Almost 50% of that has their Aadhaar IDs created, and most of the schemes which the department is running, whether it is reproductive and child healthcare services, tracking of communicable or non-communicable diseases, the anti-diarrhea campaigns. So most of these campaigns, the data collection is linked to this portal done by frontline workers, and since the entire platform is Aadhaar enabled, so all of it is helping us generate health records also, enabling us to create the new list so as there is a decision making based on actual data, not on the basis of estimates. Now, talking about the facility level interventions on the digital platform, the most important is the hospital information system. So this is of relevance to one and all, not only for the public facilities but for the private facilities. The entire chain of activities in any hospital, right from registration to the OPD services, IPD services, admission, discharge, delivery of medicines, lab tests, radiology tests, everything is made online once HIS is put in place. The journey though is very challenging. There is a lot of resistance on the part of both public and private hospitals to actually adopt it, make it live, to make the records online. OPD registration, prescription again remains a challenge. So this is one key area. Like we have around 42,000 reported facilities in the state which have adopted HIS. But this is again a very challenging area. How do we simplify the HIS system? How do we make them more usable for the hospitals so that there is a less of resistance? How do we make them cheaper? How do we use AI and modern technologies to simplify them so that the time of the paramedical staff or the doctor, less of the time is wasted in utilizing HIS, more time is utilized in patient care. But this is a very key area of healthcare reform as far as technology is concerned. E-Sanjeevani, many would have heard of, so teleconsultations or distant healthcare, this has become really a key word in today's ecosystem. So government has also adopted it, and almost 5 crore teleconsultations have been done so far. These are for the people sitting at the village level who even sitting at their home or after approaching the Ayushman Arogya Mandir, a sub-center or a PHC can access the specialized healthcare professionals sitting at the CHC level or the district hospital or the medical college level. So daily around 75,000 teleconsultations are being done, electronic health records are being generated. So this is really a transformational movement where, because not everybody can go to a tertiary care center. So sitting at the village level also one can access these services. We are also in the process of supplementing them further. We are developing more spokes and more hubs. We are involving in the private sector also. The phase 2 is also to be launched this year by the state. Now, supplementing all these have to be certain innovations which fill in the gaps. So, I would talk about a few of them. So, talking about these innovations, as I said, most of our health professionals and our health facilities, already their IDs have been generated, and they have been generated using the foundational platforms of UPK Swasthya Kendra and Manav Sampada portal, which we have linked to our Ayushman Bharat digital mission. Another important innovation which we are working on right now is ensuring that a citizen who is sitting at home, he is able to book an appointment in a public hospital, pay the ₹1 registration charge sitting at home, get a SMS, go directly to the healthcare center, show the SMS, and may not have to stand in a queue, waste his time and energy standing in queues, and directly approach the doctor. So taking a cue from private facilities, we are in the process of testing this system, and once it is rolled out, all the public facilities will have a facility of online appointment booking, online registration and online payment. Now this another innovation which is already running is with the help of the private sector. Districts hospitals have ultrasound centers, but the community level hospitals, most of them do not have ultrasound machines. So taking a cue from that, we have involved the private sector, and for pregnant women in the second and third trimester of their pregnancy, vouchers are generated, and once their need of ultrasound is determined, they can use this voucher within a month and redeem it at any of the empaneled ultrasound centers in the district or in the state. Now, we are moving ahead further on with that and picking up from the ultrasound model. This is in the stage of rolling out. We are also targeting to provide free MRI services to the citizens of the state through the district hospitals. Herein again a voucher will be generated once the need is identified at the district hospital level. The voucher will be redeemed at any of the empaneled MRI center available in the district, and the cost of course will be reimbursed by the government. So what I am trying to say is that we are trying to use technology and innovation to fill in the gaps wherever we are identifying the gaps. While the government is able to cater to all the basic needs of the public, as far as the specialized services are concerned, we are trying to fill in the gaps wherever possible by rolling out all across the state. Where that is not possible, by supplementing them through PPP model or through various innovative measures. Another very key initiative where we have the private sector involvement also with us. The private facilities already the lab tests, the radiology reports are sent to citizens on their WhatsApp and their SMS. Taking a cue from that, now for all our public facilities also we have made this facility available. Now the lab reports which are generated at district hospitals and CHCs, they are sent to citizens through SMS. We are integrating it through WhatsApp also, and that should also be live in due course of time. Taking that a further step ahead, we have integrated the LIS systems, the lab systems with the hospital information systems so that the lab reports are available throughout the life linked to the Aadhaar ID, and they are available as an electronic health record. Another innovation in which we are working through Government of India is the scan and pay system. So while most of the services in government hospitals are free, there are few 1% of the services may be paid. So for them, the scan and pay system is being worked out where through utilizing the QR code, the payment can be done. So these were a few of the innovations which the state is rolling out and few of the challenges also which we are facing. Now the most important one is how do state involve or utilize these processes for intelligent decision making. Two of the platforms which we are already using, I would like to highlight here. One is the DSP platform. All the communicable diseases or the symptoms which are there spread across state, starting from the COVID outbreak. That platform has been now escalated as a UDSP platform, and all the diseases are tracked on it, all the labs are linked to it. So any disease outbreak in any part of the state, any case that is reported on this, and therefore the control, if it is a localized disease, if it is a district-based disease, if it is a village-level disease, that data is available to us 24/7, and therefore the preventive action and the corrective action both can be taken very easily. So this is one of the initiatives of UP which has been appreciated by one and all and is running in a very good way. Another one is the HOPE system, which is a surveillance system again for monitoring all the district hospitals. More than 5,000 cameras have been placed across these facilities, and they are being monitored 24/7. There is a 24/7 call center also. So what services we are actually providing to the citizens, how happy they are with that. We are monitoring them through the CCTVs and rectifying the errors if any. In the second phase, we are now spreading it out to the community health centers of the state also, and within next 5 to 6 months that will be also rolled out across the state. So these were few of the initiatives at the state level, at the community level, at the facility level which are being taken in the state. And as I mentioned in the beginning, Ayushman Bharat Digital Mission provides the platform which integrates all of them through the UHI, through the electronic health record for the citizen, through the national claims exchange at the national level. So our aim is to integrate them in a seamless manner so that wherever we are working, wherever private sector is working, we bring them on one platform and generate useful information for the healthcare professionals, for the government and for the citizens. So the last slide, the outcome for all of us, as we are sitting here in the health ecosystem, should be that whenever a citizen interacts with any healthcare facility or any healthcare professional, his entire track record, right from his birth to the delivery, to the ANC, TNC needs, to the immunization needs, to any disease outbreak or any other screening which is done. So all health record is available online with the citizen, and all his consent is available with the facility and the professional. So that is the end outcome we are looking to achieve under the overall ambit. So these were few of the initiatives which UP has taken so far as bringing about technology or artificial intelligence in healthcare ecosystem. Definitely all of them